Hey everybody, Revive Spine and Sport Physiotherapy and Chiropractic Clinic. My name is Dr. Shane Samuel.
And my name is Girish, and we are here to talk about a common problem that most of us have, and it's sciatic pain or pain down the leg.
When we talk about pain down the leg or sciatica, which you may have heard from your medical doctor, your personal trainer, or maybe even the person next door, there's a lot of different reasons why you may be getting such pain. There's a couple of different actual anatomical reasons as to why you may be doing that. Some structures may be damaged more than others, some may be a little bit worn away. Today we wanted to go over a few of the reasons why that may happen with a few demonstrations with some of our models, and then we wanted to give you a couple of tips as to maybe if you are dealing with these things, how to be able to rectify it, give yourself better positions, and some overall relief.
Yeah, one of the common things that we see, which is related to sitting or type of professions or occupations that require a lot of bending throughout the day, is people can develop an issue with the disc. And sometimes what happens is, as we sit a lot or as we bend a lot throughout the day, the outer layer of the disc or the collagen in the disc kind of loses its orientation, and over time your disc can start bulging out like this, and when it pinches a nerve, then you can start getting pain down the leg.
Also makes a difference for the age groups too, would it not? Based off of the actual, what is actually happening. You can have many different types of sciatic pain. Particularly, you can, like Dr. Girish had said here, is we can deal with the nerve root getting tickled or compressed or irritated. We can also deal with bony change as well, which what will happen is extra bone will grow to try to give you more support as you get older and as you get into more and more of the same positions without moving. So you'll actually lose the ability to have that spinal cord or nerve root slide really nicely in and out of the spinal column. So what we want to be able to do is we want to mitigate those types of stressors so that you're not getting so much pain while you're in those positions, or at least you get something to be able to do out of it. The other thing we can chat about too is your classic sciatica, which in and of itself is actually an impingement of a peripheral tissue, or what we would say is like it's actually happening outside of the spinal column. So it would be from, I think it's about 15% of people, is the right
or less.
15% or less of people actually have piercing of the piriformis musculature, which with the sciatic nerve, which can cause pain, especially with prolonged sitting.
And one thing that's very common is, and people associate leg pain to muscle tightness in the butt. And often what happens is when the nerve that's coming out gets pinched, your body goes into a defensive posture, right? So all these muscles can tighten up, and that's a very natural reaction to the pain, and is often confused as a source of the pain. And I see that all the time in clinical practice.
I like to relate this as this is just a protective spasm from the body, right? I mean, this is why it becomes so important to know exactly why you're getting the leg pain, and there's many different reasons why, as we just explained. And what we want to be able to go through today is just a couple of different positions and strategies to be able to minimize the amount of movement that may cause that pain to get worse.
And one thing that's very common with leg pain is 70% of sciatic pain is pain that is triggered with movements and positions, and there's only like 20 to 30% where the pain is constant. So sciatic pain or pain from the nerve, if I take a finger and I pinch Shane really hard, he's going to have pain because of that. So when a disc goes and hits a nerve, there is a mechanical effect, and there is pain from a mechanical compression of the nerve. But if I keep pinching him for hours or days, you can get inflammation around the tissue, and the pain can be chemical, so it is related to inflammation. So these are some of the factors that you need to consider in relation to leg pain or sciatica. Going forward, we're going to show you some positions and some strategies that you can incorporate at home or at work to minimize your pain.
No, that's very fair. And you know what? One of the big things here is I think that we need to lay down framework and a foundation as to what our reference point will be when we want to move. And what I always look at is what's called neutral positioning. So it's very tough to be in neutral position when you are sitting, but when you're standing, you can kind of really tell. And I think that one thing that we should do is we'll have a more in-depth video about movement later on. But what we want to do here right now is I want to show you guys how to be able to bend properly with a neutral spine. So if you don't mind setting up, Krish, we're just going to use classic meter stick. I'm sure you've all heard this before, is when you're going to go to bend over, keep that back straight. But it is actually very imperative. It's going to touch the top of his head to where his tailbone is. And he wants to be able to push his hips back when he goes to bend forward. You see how there's no movement there, no micro movement, perfectly straight spine. Very important to be able to bend in this fashion. You can still use your legs when you're doing this, which is very important, but you don't want to be able to round at the. All right, so now that Garish and I, we've at least given you some groundwork for how you should be moving with your spine when it's a bit cranky or your back's a bit cranky and you have some leg pain. I want to show you two ways that we can actually give you some relief when you're dealing with the back pain or the leg pain. So what we're going to do with our model here, we're going to have him lie flat on his stomach, but not just flat on his stomach because that may still cause some aggravation. We want to be able to create some space in the lower back. So what we're going to do is we're going to prop him up on a couple of pillows. So if you don't mind, lying flat on your stomach and just lying on top of the pillow. There you are. Now what you can see here, the pillow, what it does is it props up the back, giving it some space, and in the end, what we kind of, if you've been following along enough, you kind of can tell that that compression or irritation of the nerve root is because there's less space. We're actually trying to increase that space to be able to give them some muscular relief. Over time, maybe 3 to 5 minutes, you want to potentially, without moving your back, you want to try to be able to remove the pillow so that you can actually start to prop yourself up to offer more relief. So come on back down and just lay on your elbows. Everything nice and quiet, let the low back relax. Sometimes this position doesn't quite get it done. So what I'm going to have my model do next is actually lie on his back, and we're going to demonstrate the 90-90 position. So if you lie on your back. Now what the patient's going to do here, he's going to bring up his legs, and he's going to hold them here like this. You can see that he's made a 90-degree angle with his hips, 90-degree angle with his knee joint. And what this really does is it allows the pelvis to be in good position relating to his rib cage. It's going to give enough space in his lower back to be able to quiet down the muscles and remove the irritation of the nerve root, and also allow him to breathe better. Again, 3 to 5 minutes in this position for you can do this as many times throughout the day as you'd like, as long as you're getting relief for it. It's very important that if you are dealing with pain and severe pain, especially leg pain where you're dealing with a potential weakness or loss of sensation, that pins and needles, we can explain what that means further, but that becomes very imperative that if you are dealing with these, it's important to make sure you get yourself checked out by a chiropractor or a physical therapist or your medical doctor so you get the appropriate treatment that you need. As always, on behalf of myself, Dr. Shane Samuel, and Garish, we're thanking you guys for watching.